The sick, the diseased, and the injured all need medical attention during the Civil War era. This is not as easy as it is to come by as it is today. How were the sick and injured treated, and what discoveries have the doctors and scientists come up with that helped shape our medicine today? There were many heroes in the Civil War besides those who fought, from doctors to nurses, and many more who gave care to soldiers on the front lines, at field dressing stations, to giving care to more permanent hospitals. Some heroes included Captain Sally Tompkins, who opened up her own hospital that had such a low death rate she was named captain by Confederate President Jefferson Davis. Jacob Tomer, an enlisted hospital steward, assisted surgeons and was responsible for mixing and dispensing drugs. And Confederate surgeon John Forey Zacharias, who successfully experimented with the use of magnets to remove dead tissue, in most cases of hospital gangrene. As Stanley Burns mentions in Civil War medical practice, there were about 55,000 physicians in the United States at the start of the Civil War. Most were poorly trained. There were no correct theories of disease and no adequate specific therapies except for quinine for malaria, opiates for pain, and vaccinations against smallpox. Several medical sects developed, each posing their idea of disease and treatment. The allopaths offered heroic therapy treating patients with bloodletting, blistering, purging, emetics, essentially treating symptoms with harsh, deadly compounds. Theory was to affect the opposite of the disease state. By 1861, the therapeutic method was in decline. However, dosing with powerful measures of mercury, antimony, arsenic, and other deadly compounds was still popular. The botanic-based medical sects that offered mild therapies appeared successful as they did not blatantly kill or maim patients. However, the military system could only support one school of medicine. All sects lobbied Congress, and allopathy was chosen. As times have changed, the medical community has had major advances and more highly trained and specialized doctors and nurses. However, some things we have learned from the medicine during the Civil War era include quarantining, which was done to fight the exposure of yellow fever. The use of anesthetics to help minimize pain during surgery, and the ambulance system, which transported wounded soldiers from the battlefield, and the trains and boats to more effectively transport to larger facilities, such as we use helicopters for today. Even though practices seem to not be highly effective, these basic procedures have led us to the medicine we have used today.